From the beautiful Finger Lakes region of upstate New York, this is the Dental Lighthouse Podcast. We take questions from anyone in the dental profession and discuss what it takes to win not only in dentistry, but in life. Business, leadership, relationships, parenting, health and wellness, money management, nothing is off limits on the Dental Lighthouse Podcast. I'm Jason Tanoory, your host, and have over 20 years of experience to pull from. Learn from my mistakes and let me help you collapse time so you can become the best version of yourself. Welcome back to the Dental Lighthouse Podcast. Next on the show, we have Carmen. Carmen, how can I help you?
Hi, Jason. So we are struggling with how to compensate our hygiene team. We currently compensate them at 30%, kind of a eat what you kill model. They do have a base of 40, so they never go below that base, which gives them security. We've been doing that for about 7 years now, and we're looking to transition to something different, primarily because we get some resistance when new programs come on board, such as like the microscope and embracing more perio diagnosis through that microscope program.
Okay.
So I have struggled with, do you go to a tier system? So I know at DSI, we talk about tier systems that helps people kind of understand their level and give them a pathway to increase their, hygiene as a profit center, right? And what does that look like? What does that culture look like as well to become just a more valuable team member? But then I don't want there to be lost opportunity to really push production and increase production, just focusing on like being a great team member by doing the tier system. What do you think?
Yeah, this is a tough one, right? And I think it's one that as the oral systemic research becomes more and more available, it's going to be an issue that gets brought up a lot. I have a couple questions, if you don't mind. How big is your hygiene department now?
So we have 4 hygienists each day.
Okay.
We have about 8 hygienists total in the practice.
Okay. And you're open 5 days a week?
We're open 5 days a week.
So
we have 8 laboratories.
So 20 hygiene days. Okay. And $40 an hour, is that fair market value, or is that more of a baseline kind of just in case you don't hit a certain percentage of adjusted production?
It's exactly what you just said. So I would say for our area, going rate for a good, what people are really seeking is probably 45.
Okay.
Our hygienists and the model that we pay them, they average between 45 and 62.
Wow.
Based on, so they're being compensated very well, and the program is working. Let me interject something else. We currently have our doctors see new patients for the first visit. And when we build, because we are expanding, Jason, to a 15-op practice, which is super exciting.
Go you.
First quarter 2025.
Let's go.
That's right. Yeah. But when we do expand, we are looking to switch that to more of a hygiene-driven model. And so that's the other issue, that first appointment doesn't carry a lot of production value. And so we're concerned we may get some resistance because, and I agree, they may not be compensated fairly for the work that they do at that first appointment with a production only model.
Okay. Well, let's dissect the second point that you made first. I'm surprised to hear you say that a new patient in hygiene is not a productive appointment. Can you unpack that for me? Because it's been my experience that a 90-minute new patient exam, we're talking about 4 bite wings, a pan. I'm assuming, and you know what happens when you assume, I'm assuming that the hygienists are getting credit for radiographs, or is that not the case?
Yes, they do. Absolutely. We would never do bite wings or a pan together because then it would be compensated as a full mouth.
Okay.
A little bit differently. So in our new patient workup, we do bite wings, and then we do have a very comprehensive exam for that appointment because we're Coy's. You know John Coy's. I'm sure you've heard of that.
Yeah.
So it's a little more deep and involved, and there's a lot of photographs. The perio charting happens at that visit, and so our hour for that new patient workup is pretty much exam and bite wings. And so if the hygienist were to take that over, that's going to give them now they may be able to condense it with the help of an assistant, but it would probably be just the bite wings would be their production from that.
Okay. So it's not even the prophy if they're due for a prophy. If
we transition it to the hygiene department, we would have them clean their teeth at that time as well.
Okay.
So they would get that. And I would expect it to be a 90-minute appointment.
Yeah. So you're basically saying 4 bite wings and a prophy in 90 minutes versus 60 minutes because,
correct.
Yeah. So I could see that. I could see there being a little bit of pushback there.
Yeah.
And we can unpack that a little bit further as you guys get closer to opening up. But let's talk a little bit about the first point. So we are fully implementing microscopes as well. And we have a similar model to you. I'll describe our model, realizing that there's no right or wrong answer here. Mm-hmm. We pay a percentage of adjusted production. It's not the same across the board. It's based on tenure. So, for example, a new hire would get 30% of adjusted production. After 5 years, it would go to 31.5%. And then I think it tops out at 33% after that. So very similar. We don't have a base pay that's lower than fair market value. Our going hourly rate is about $45 to $46 an hour for someone that has a little bit of experience. So we're basically saying to the hygienist, your base pay is a fair hourly rate, or a percentage of adjusted production, whatever is more for the month. So super similar to what you guys are doing. Now, because our base pay is a little bit higher than yours, we call it incentive pay. That delta is going to obviously be smaller, right? Mm-hmm. But to your point about when we're going to implement things that may not be as productive, I think the first question that needs to be asked is, are we implementing things simply to create more work for the hygiene team, or are we implementing things truly in an effort to increase our standard, right? Deliver a higher standard of care, a more efficient standard of care, any of those things, right? And knowing you guys the way I do, I know you realize that. So you would never just introduce something simply to create more busy work.
No.
And I would guess that the hygienists, at least early on in this process, may have the perception of they're just asking me to do more things, and it's not leading to this increase in daily, weekly, monthly revenue like it should, or like I'm hoping for it to lead to. Mm-hmm. I can't speak for where you're at in the process, but I do know that it's been our experience that when you get competent at taking a bacterial salivary sample and showing it to the patient, it literally takes from the moment you decide you're going to do it to the moment you can show the patient, once you're trained well, less than 5 minutes, right?
Yes. Yep.
And our argument to the hygiene team has been, it's always taken you more than 5 minutes to educate the patient on their need for periodontal treatment. Mm-hmm. And that's in fact what we're seeing. So we're seeing that the time allotted to educate the patient to get them to say yes to the treatment they need is actually shortening, which
Mm.
is allowing them to do two things: more periodontal procedures and get them started in a more efficient manner or sooner, let's say.
Mm-hmm.
Are you experiencing that yet?
Yeah, we have a couple of hygienists that have really, taken the microscope to the next level. They're doing it regularly. But that's a very good point. My guess is it does take less time to, air quote, convince the patient that they truly have a need, because as soon as they see that on the screen and they see the high risk parasites, they're extremely concerned. And they immediately want to go into treatment. So that's a good point.
Yeah. So that doesn't happen overnight, but
Mm-hmm.
as the hygienists become more competent, as they get it down to from the moment they decide in their head to do this to the moment the bugs are up on the screen, it should be no more than 5 minutes.
Right.
And once they start to have patients say yes, literally within seconds of seeing this, it makes their life much, much easier. Now, I'm assuming that periodontal procedures being accomplished by the hygienist is more profitable from an income perspective for them, right?
It would be, absolutely.
So if I had to convince a patient, or if I had to explain the why to not a patient, to the hygienist, I'd be like, look, you're great at diagnosing periodontal disease, and but the reason that we're introducing this microscope is because we feel you can present periodontal disease in a more efficient way, a more convincing way, and you can get more patients to say yes. That's our goal here. That's why we're doing it. And I would ask you to give us a little bit of grace here, 3 months, 6 months. So as you become acclimated to it, as you get used to the benefits of it, as you start to see these patients that you've been trying to get to do periodontal treatment for a while, as you start to see them say yes, you realize that the reason that we introduced this was ultimately to increase our clinical standard, ultimately do way more perio that should have been being done all along, but we were struggling to get the patient to say yes. This is the straw that broke the camel's back. This is that one piece of technology that we needed to get more and more people to say yes.
Mm-hmm. Okay.
That's the approach that I would take.
Okay.
The other thing that you could consider, again, there's no right or wrong answers here. I believe giving people choice. And if you truly wanted to have the hygienist feel empowered, you could offer them two types of compensation structures.
Sure.
You could say, look, we really think you should stay on a percentage of adjusted production, 30%, because we realize that, you're a specialist and there's so much opportunity for you to do great things for our patients and earn a tremendous amount of income. But if that's not motivating to you, if you get anxiety about this and all of this new technology, we could compensate you a different way. We could just pay you fair market value. We could pay you $45 an hour. I suspect that you'll be making less than you could be making. But if you want the choice, here are the two choices. Now that opens up a can of worms, but it may be, especially with a hygienist, it may be something where you're like, look, guys, I'm really trying to hear you out. Let's talk about different options that you have available to you for compensation.
Sure. So one thing I considered, and I like that, Jason, possibly having, two models. Why not? Right. Working with people, especially in this climate, it's hard to find team members sometimes.
100%.
But one thing I thought about was not going to a straight pay. It was the idea of having a little bit of a hybrid model between the tier system, which fosters that, hey, if you're utilizing the microscope regularly, and hey, if I see you, learning new systems and implementing them in the office, and if you're elevating your skills, and achieving these higher levels, we can pay you even a higher rate. Maybe the tier system goes from like, say, 43 to 52, right? And then on top of that, we'll give you a percent. I have my little notes here because I wrote it down. Tier 1 would get 10%, the difference beyond their 3.3, their pay. Tier 2 would get 15%, and tier 3 would get 20%.
Yeah.
So it kind of is motivating both ways. It's motivating the person who is focused on high production, but it's also motivating the person that's focused on implementing new things into the office and taking things to the next level, right?
Yeah.
I have an example. I have a hygienist, super driven, but it's always all about the money. And while I like that and respect her drive, she misses the boat on things like the microscope. And so she's a frustration to me.
Yeah. Yeah. It's a classic, stepping over dollar bills to pick up pennies, right? Like sometimes you want people to see the long-term vision here. And, really at the end of the day, we should ultimately be concerned about doing what's in the best interest of the patient. But that's what's so unique about the microscope, that it kills two birds with one stone. Like, you're truly doing what's in the best interest of the patient and truly benefiting from the financial ramifications of providing that care that the patient's ultimately saying yes to because of the microscope. So I think sometimes we just get so caught up in the short-term lull as we're implementing something. We see a drop in our income for one particular month, and you're like, oh my gosh, we got to stop this. Like without realizing that, like, no. Like, once we fully implement this, it will benefit both the patient for sure, but also us, because we're going to take our perio percentage from 23% to 40%, right? And there's going to be a windfall of income that comes with that, while at the same time providing great services to the patient. I think your tiered system makes sense. Couple. I'll play devil's advocate regarding it. I have personally found that it's hard with hygiene to develop a tiered system because there's not at least in New York State, there's not a ton of auxiliary additional tasks that can really be associated with a tiered system. So for us, it's like licensed or certified in laser. It's anesthesia, the ability to give anesthesia. You could make the argument, like you did so eloquently, regarding the microscope. Salivary testing is another one that you could implement. But beyond like 5 or 6, like kind of unique tasks, it's not like a dental assistant where it's like temporary crowns, iTero scans, orthodontics, implant. Like there's like 15 or 20 things that you could put together on a tiered system for assistants. It's not like that with hygiene. So just keep that in the back of your mind. And then the second thing I would worry about with your great idea is the time commitment to track it. Like there's a lot going on with what you just described. And if you feel like the hygienists are disciplined enough to track that themselves, great. If you feel like there's an individual in the office that would have to manage that, you have to account for the amount of man hours that's going to be needed for something like that.
Yeah, that's a good point. That is a good point.
I hope that helped it a little bit, and you guys have some clarity with the decision that you want to go with.
Yeah, no, it's given me some things to think about, and I appreciate it, Jason. I mean, I'm maybe going to modify it a little bit, but I got to think on it.
Yeah. Noodle it while you're having dinner, while you're on vacation over the next couple of weeks. I think, again, the most important, I always go back to the why. Why are we doing this? Right. The answer is not because we're looking to give you more busy work. The answer is because we truly believe that this will educate the patient to a completely different level. It'll get the patient to say yes much quicker than we're currently getting. And it'll ultimately allow us to deliver the patient care that they really need, which will indirectly lead to an increased income. So it becomes a win-win. It doesn't happen overnight. And I can speak from experience. It's been months of us implementing the microscope in multiple practices. And to your point, some hygienists are freaking loving it and they take off. And some hygienists are afraid to even broach the subject.
Right.
So you'll get there.
We will, for sure.
It was so great talking to you.
Yeah. Thank you so much, Jason.
Don't hesitate to reach out if you have any other questions. All right.
All right. Sounds good.
That's it. Yo, welcome back to the Dental Lighthouse Podcast. We're going to go into the inbox and answer a question. You can always reach out to us with any questions, concerns, comments, and we will riff about them on the air. The address is podcast@thedentallighthouse.com, podcast@thedentallighthouse.com. If you're not comfortable setting up a live call with me, then shoot us an email. And if it's awesome, like I'm sure it will be, we will try to answer it on air. So go into the inbox and we have a email about time management, about balance, work-life balance, and basically asking how we manage all that. So let's spend a few minutes unpacking that, realizing that my way is one of many ways. Certainly not the best way. It's not the worst way. It's just the way that works for me. I would encourage you to maybe take what I do, if this is something that you're struggling with personally, and tweak it to accommodate your situation in your life. But for me, it starts with a calendar. It starts with what I call my ideal week. And I try to map out where I'm going to be every 15 minutes of the week, specifically. First thing you need to do, if this is going to work for you, is decide how many hours per week you are going to dedicate towards work. Now, I know a majority of you guys listening, guys and gals, are clinical dentists. You own dental practices. So when I say work, I mean hours dedicated towards your dental business, at the chair, away from the chair, and everything in between. So how many hours per week is that for you? It's probably going to be somewhere between 30 and some of you guys, unfortunately, are close to 80. I was on a coaching call last week with a great guy who's in the 75 to 80 hour per week range. Very unfortunate because you could start to hear in his voice that it was not healthy for his marriage and it was not healthy for his physical and mental well-being. So we've started to get granular and tactical on how he can remedy that. But again, let's go back to a 30,000 foot view. How many hours per week are you going to work? Research is very, very clear on this, that as you get north of 55 hours per week, you start to make bad decisions. The wheels start to come off and it's not healthy for anybody. So even though some of you are in that 25 to 80 hour range, I would encourage you to make sure that you're maxing it at 55. Now, personally, I roll at about 50 to 55. I am intentionally trying to lower that as I try to gamify my life. Can I be as efficient and can I have as much influence on my business, on the people that depend on me at work, dedicating 45 hours per week as opposed to 55? Maybe I can, maybe I can't, but I'm going to try to figure out what the answer to that question is. But come up with that number. Let's say for this conversation, it's 50 hours per week. So now that you have that number, you have to take that 50 hours and decide how much of it's clinical and how much of it's non-clinical. The clinical hours are pretty easy to set. Maybe you work 3 days a week clinically. Maybe you work 4 days a week. Well, put that in your calendar. I use a Google spreadsheet. You can use Google Calendar, do whatever you want, but put those hours in. So maybe it's 4 8-hour days. So that's 32 hours per week. So now you have 18 hours a week left. for work-related things. Now, with those 18 hours, I like to break it up into what I call shallow work and what I call deep work. Deep work, coming off of Cal Newport's great book, Deep Work, is when you basically lock yourself in a room and you get shit done. You develop systems, you develop protocols, you look at P&Ls and decide what here is working, what's not working. You do all of the things where you really can't or shouldn't be interrupted. For me, I turn off all web browser activity except for Google Sheets and a couple other websites that I know I'm going to need access to for information, but certainly no email, no Slack, no social media of any kind, because it's instant distractions. So I have deep work blocks sprinkled throughout the week. Deep work blocks can be anywhere from 30 to 90 minutes. You really shouldn't go north of 90 minutes. And for me personally, I don't go north of having one 90-minute block per day. I think I have 3 or 4 spread out throughout the week. People that would rather do 30-minute blocks, you can do a 30-minute deep work block, then get up, move around, do some jumping jacks, grab some water, maybe some burpees or something for a couple of minutes, and then sit right back down and get back to work. So that's clinical work. That's deep work. And then shallow work is, I like to use the phrase, shaking hands and kissing babies. So basically what I do is I try to be present at work, at team meetings. I try to be present in the hallways of some of the offices that we have. I try to just pop in and check in with people, making sure that they're doing okay, seeing if there's any obstacles I can remove from them. Shallow work could also be lunch with a prospective doc that might want to join the practice, a bank that I'm trying to develop a new relationship with. Any of that stuff is considered shallow work. So I will fill up my calendar up to 50 hours per week, soon to be 45, with those types of activities. Once those activities are done, then I am no longer working. Now there is an occasional one-off if I have a huge presentation to do or something like that. But 99% of the time, I am sticking to the schedule that I've put, into my calendar. One of the ways that I'm able to accomplish that is reaching out to people in my life that are close to me and asking for accountability. It's a classic example of, if you want to lose 25 pounds and you really want to make sure that you're successful at doing it, then tell everybody that you know that you're trying to lose 25 pounds. I can assure you that when you lose your willpower and you reach for that donut, if someone is in the room that you've told you're going to try to lose weight, they're going to look at you funny and they're going to be like, what are you doing? I thought you told me you were trying to lose weight. And that level of accountability can keep you on track. The same holds true with trying to keep to a schedule or trying to keep some level of work-life balance. When I tell my wife, Kara, that my work day ends at 4:30 and come at 5:15, if my laptop's open during dinner, she's going to look at me cross and she's going to be like, dude, you told me that this was your goal. You told me that your goal was to end your workday at 4:30, 5 o'clock, whenever it is. And you're not staying true to what you said you wanted to accomplish. So making sure that you tell people, if you have older kids, tell them. If you have a spouse, healthy relationship, tell them. Friends and family, tell them. Just tell everybody, right? This is what I'm trying to accomplish. The other things that I do to help accomplish that, for example, I'll roll into the house around 5 o'clock. I leave my phone in the car. I leave my computer in the car, out of sight, out of mind. So if I'm sitting down for dinner and my phone's in my pocket, I'm so much more tempted to pull it out, check text messages, check things like that. If my computer is in the other room and I need to worry about a Slack message that I sent earlier the day, I'm going to be more prone to want to get to my computer and check it. Even if I don't check it, the fact that I'm thinking about checking it means that I'm not nearly as engaged with my wife and kids at dinner as I could or should be. So I have personally found that leaving all of those temptations in the truck and having them be out of sight, out of mind really, really works well for me. So those are a couple basic principles in terms of keeping work at work. Now, your life should not just be focused around work. It should be focused around relationships. It should be focused around fitness. It should be focused around mental, emotional, spiritual wellness. So you have to compartmentalize those facets of your life as well. And I personally have found that the best way to do that is to prioritize those things first thing in the morning. Having 5 children, I realized early on that as soon as they get up, my day's basically over. I will not be able to accomplish anything of significance. So when I realized that almost a decade ago, I decided that I was going to prioritize going to bed early and prioritize waking up early and doing all of those things before the kids wake up. So again, this is a you do you phenomenon. This is what I do. I truly believe that the perfect morning routine starts the night before. So what does that mean? So for me, I spent some time in the sauna. It helps me sleep better. If you don't have a sauna, a hot shower. I turn off all electronics at least an hour before I plan on going to bed. I don't eat anything at least 3 hours before going to bed. Again, this may sound radical to you, but it's worked extremely well for me. And I'm usually in bed by 8:30, no later than 9 o'clock. Now, the only time that changes is if I have a kid that has a game or a practice. I got to pick them up late. It is what it is, right? You got to be a dad first before a sleeping beauty. So, but those are rare situations. Even last night, my senior 18-year-old son had a lacrosse game, big game against Victor, crosstown rival. Game went till 7:30. Came home, did all the stuff that we needed to do. I was in bed by 8:45. So if I can be in bed reading by 8:30 or so, falling asleep by 9, I can get 7 hours of sleep and wake up at 4 a.m. Again, that's early, but that's what I do. Okay. Because I need to get lots of things done before the kids wake up. So wake up at 4 a.m. I spend some time with the good book, reading scripture. I like to journal. I like to meditate. And then I spend some time going over my calendar for the day and identify what we call the big 3. So what are 3 things that I absolutely have to accomplish before the end of the day? It's the whole concept of eat the frog. You know, when's the easiest time of the day to eat a frog? First thing in the morning, so you get it over. So when you identify your big 3, you do the one thing first that you just really don't want to do, that you're just kind of dreading. Just get it done with. And once you get it done with, you'll be like, oh, okay, that was easy. And then those other 2 things are even more easy. So I usually do those things from 4 to 5 a.m., from 4 to 5:15. And then I'll get a really good workout in from 5:15 to 6. Roll into the house at 6 o'clock. My kids are up by that time. I'm making them breakfast, kind of talking about the day, maybe watching a YouTube video with them from Dave Ramsey or some Bible scripture or something like that. They love doing that stuff. And then taking them to school. And then I'm starting my workday. And then I just repeat. So it's amazing to me that when you compartmentalize your day, when you have all of these things laid out at a super high level, when you set up structure in place to have other people keep you accountable, to not be tempted by your phone and your computer at the end of the day. It's amazing how successful you can be. To use a poor analogy, if I had a problem with alcohol, or if I had a problem with potato chips and highly processed foods, the number one thing that would not work for me is keeping those things readily available and accessible. If I had a pantry full of potato chips and cookies, realizing that I have a problem with potato chips and cookies, I would be eating potato chips and cookies. If I had a problem with Tito's, well, maybe I do have a problem with Tito's. No, I'm just joking. I haven't had a drink in about 3 months. That will change next week after my bodybuilding competition, but that's the story for another day. If I had a problem with alcohol, the dumbest thing I could do is keep alcohol in the kitchen, right? So if you have a problem with digital addiction, if you have a problem with always checking in at work, if you have a problem with constantly being on your phone or on your computer, out of sight, out of mind. If you want to be fully present with your family for dinner, then you have to keep that stuff in the car. You have to keep that stuff off in another room on a different floor of your house. And at least for me, those have been some strategies that have really worked, helped me keep a sane work-life balance. So hopefully that helps. If you have follow-up questions on that, don't hesitate to reach out. I can share my my ideal week calendar. Like I said, it's a simple Google spreadsheet. We'll figure out a way to share it in show notes and take it, copy it, and then modify it to best fit your needs. And then share it with someone that's close to you and say to your spouse, say, hey, spouse, I'm really trying to keep to this schedule. Always communicate the why. I'm trying to keep this to this schedule because I feel it'll make me a better dad, a better business owner, a better Christian, a better human. And I really need your help. I need you to help keep me accountable. Here's the schedule. I'll post it on the fridge. And if you see me veering off course, please call me out. Give you permission to call me out because this means a lot to me. It means that I'm going to be a better spouse for you. So it's important. So hopefully that answers your question. Again, please don't hesitate to reach out. If you have additional questions, don't feel comfortable calling in the show. We can kind of riff on the question and hopefully I'll answer it with enough clarity that helps you. Thanks. Thank you. That wraps up another episode of the Dental Lighthouse Podcast. You have a choice today. Choose to be a lighthouse. Lighthouses are powerful and steadfast. They are beacons of light for others to reference when life gets turbulent. Go out into the world today and become a lighthouse for someone. Give more than you get. True joy comes from serving others. Start today. I'm Jason Tanoory, your host. Thank you for listening to the Dental Lighthouse Podcast. For more information, podcast show notes, or links to anything that we have discussed today, please check out our website, thedentallighthouse.com. We would love to hear from you. If you would like to get on the show, please email us at podcast@thedentallighthouse.com.